Hello there friends, this is Miriam from Pain Outside the Box, and a while ago I had recorded a short somatic tracking exercise for chronic pain, and unfortunately that video wasn't of the best quality sound-wise, so I've decided to come up with somatic tracking version 2, which also comes with a little bit of variation on the exercise. So first of all, before we start, I'd just like to remind you that for somatic tracking, you shouldn't be doing this exercise if your current pain levels are an 8 on 10 or higher, okay? So you should do this exercise with me here or on your own whenever your pain levels are somewhat tolerable, okay? So not when you're at your worst. There are other things you can do when you're at your worst, and it shouldn't be this exercise, because the purpose of this exercise is to get you to observe your pain, to familiarize yourself with it, and to get more comfortable with the pain. So this is something that's quite hard and overwhelming to do when your pain levels are like a 9 or 10. This is why you have to first find the opportunity when pain is a little bit more bearable before you do this exercise. Okay, so having said that, we can get started. So make sure that you're in a comfortable position as much as possible, okay? Either sitting down or lying down on a bed. You can also do the exercise standing up if you wish. And I'd like you to get your attention on any part of the body that feels uncomfortable or painful. So whichever sensation feels the most uncomfortable or painful right now, the one that's getting your attention, I would like you to focus on the sensation now. And we are going to pretend that we're getting really curious about this sensation because it's something that we want to know more about. So the aim of this exercise is not to get rid of this sensation. It's to get to know more about it. It's to let it in. So invite it in. If you are really curious about this sensation, you would actually want to know a little bit more about it. It would be okay, actually, if the sensation increased a little bit in intensity. So just observe this area of your body and notice what's happening there. I'm just going to give you a minute to really tune in to this part of the body that feels uncomfortable or painful to you right now. And remember to breathe as you observe. And you might notice that the pain moves around, maybe it changes, maybe it's pulsating, maybe it isn't even painful, it's just a sensation, a tightness. So notice it exactly for what it is, and not for what you think it might mean. So think about isolating the sensation from your past or from the future. Let go of any thoughts that are telling you or trying to guess what this could mean for your future. Those thoughts telling you that it might intensify, that it might get in the way of what you want to be doing. That's the future. Right now, what you have is this sensation. It might be uncomfortable, it might be painful, but it's isolated from anything else. It's temporary, it's a present moment sensation. And also let go of any judgments towards the sensation. That voice in your head telling you it's bad, that you ought not to have it. It's okay to have it, you actually want to know more about it. So observe, get curious. If the pain moves around, follow it around. Imagine this is like a young toddler and you're just observing what it's up to. Maybe it's up to some mischief, it's true, but you're curious more than annoyed. So just observe the sensation. For a couple more seconds, just allow it to flood in. Imagine you're just opening the doors. You've been trying to restrain it, you've been trying to change it for so long, but right now you're allowing it. No more resistance. If it gets intense, take a couple of deep breaths into the area and imagine that as you're breathing out, you're releasing some of the tension in that area. So it's like you're breathing in through the pores of your skin in that painful or uncomfortable area, and you're breathing out through these same pores of your skin. And as you're breathing out, things are easing a bit. But it's okay if the pain is still there. It's okay if the sensations are there, if the discomfort is present. The aim of this exercise is just for you to get a bit more familiar with these sensations. And now I'd like you to let go of this area. So imagine you're just putting it in the background. And instead, put your attention to your chest and throat area and see if you can notice any sensations there, any sensations that are also linked to emotions. Is there any tightness, any discomfort, anything that feels like it's not right there? Any fear? And observe it for a little bit. Maybe you feel sensations in your head as well. Maybe there's overwhelm. Just be curious about this as well. Don't attempt to push these sensations away. But if the sensations get too overwhelming, I would encourage you now to choose a part of your body that feels comfortable or neutral. So for those of you who aren't feeling strong emotions, who are comfortable noticing any unpleasant emotion, they can just keep noticing these emotions for a minute or two longer. Those of you who feel a bit overwhelmed, like it's too much to notice the anxiety or the fears, I want you to choose a different part of the body to focus and anchor your attention on. So it could be your toes, it could be your ears, any part of the body that doesn't cause you any worry or any fear. A part of the body that you're totally okay with and that right now feels quite good and comfortable. So everything else goes in the background. And your attention is now on this part of the body that feels good. And now I'd like everyone to anchor his or her attention on the breath now. So any other sensations in the background, it's okay if they are still there. You're just not focused on that area. You're just focused on the breath now. Coming in and out, not trying to breathe differently at all. So if your breath is a little bit hurried, that's okay. Not trying to change anything, just being with whatever is. You can also now spread your attention from the breath to your whole body. So notice your body as a whole as you're sitting or lying here. Maybe you can feel some tingling in the hands and feet if you really notice. Feeling the energy flow through your body. These subtle sensations that tells you that everything is changing all the time and everything is temporary. Your pain is temporary. Even strong emotions can be temporary. They fluctuate. And remember that the worst thing that we can do for our chronic symptoms or for our unpleasant emotions is to try to change them too soon. We first need to allow things to flow. We first need to be more okay with what we're feeling, physically and emotionally. And this is the very purpose of this exercise. So let go of any expectations for things to be totally different after the exercise. That is not the aim of the exercise. The aim is to get more familiar and more okay with the way things are. So a few more seconds of silence. Maybe we give ourselves a smile, reminding ourselves that it's okay that we're feeling whatever we're feeling. We are human. We go through stuff. The body responds accordingly. And that's okay. Okay, friends, and that's all for today. So I would encourage you to repeat this exercise whenever you notice a hint of pain or pain flaring up a bit, but not when the pain is like a 9 or 10 on 10. Okay? Just consider it as a practice of you being okay with what there is. And if you do it with this intention, I promise you will see the results. Thanks everyone, and have a lovely day. Bye-bye.